We're here today with Dr. David Feliciano. We're going to talk a little bit about his history with the Panamerican Trauma Society. Everybody in the world that can spell trauma knows Dr. Feliciano, certainly one of the stalwarts of injury care, and we're delighted he was able to take some time to talk this morning. Thanks for coming by, David.
Thanks, Tom. Good to see you. I've been a member of the Panamerican since early in its founding in the 1990s. I can no longer remember who invited me to a meeting, but one of the countries that was holding a meeting did invite me as a guest speaker, and I rapidly became very interested in becoming an active member. I've been intermittently to meetings. They're often in South America. It's not always possible to get to all of them, but it has become one of my favorite meetings over time. I've watched the scholarship of the society grow incredibly. The first couple of meetings were less formal than they are now, but with the increased participation of more people from the Americas and many American surgeons, it's really brought a new quality to the program. The number of abstracts for presentation has just increased extraordinarily in the last couple of years. And the variety of presentations at the meeting has also improved with invited speakers, named lectureships, pre-course or pre-meeting courses, and then all these abstracts that get submitted for presentation. So the academic quality of the meeting over the past 30 years has just improved tremendously. Biggest factor for me staying involved has been the friendships with surgeons south of the border. The meetings where I met these people led to many invitations to come down to particularly South America and watch the surgeons operate on trauma. And I can honestly say I've probably learned much more from the trauma surgeons in Central and South America than I have ever taught them. The level of experience and commitment to patients is extraordinary, and the friendships that I've made with many individuals all over the continent down there have been a really big thing for me in my career. I really appreciate a lot of those friendships.
Yeah, you really, I think, fail to, or can fail to appreciate the volume of trauma care that those people provide. I remember early on I would go and they would talk about 500 penetrating injuries to the heart, and it'd be 2 years, and you go, how do you, I mean, the amount of experience they got, they don't write as much as the American surgeons do, but they sure can operate a lot.
Most of my clinical experience has been in Colombia, and I've taken night call in Cali with Dr. Ferrata and my friend Alfredo. And then repeatedly I've taken call at San Vicente de Paul in Medellin. And taking call in Medellin was interesting because there were 3 separate fully trained surgeons on call in the hospital at night, exactly because of the volume that you're talking about. You know, one of us to do in-house consults, one of us to resuscitate people in the emergency room, and one of us to actually operate on patients. So I learned so much, and all of this came through the Panamerican, really, these kind of relationships and friendship, as I mentioned.
If a young surgeon came to you and said, why should I get involved with the Pan-American Trauma Society, what would you say to him?
2 things. One, again, the academic tenor of the meetings is equivalent now to trauma society meetings in the United States in many ways. And secondly, the quality of the surgeons that you meet and the friendships that meeting engenders have, as I said, been a big part of my career, frankly.
It's wonderful. And this year, you're the Rodriguez lecturer.
You know, Dr. Aurelio Rodriguez was one of the original founders. Secondly, was an executive director for many years. And thirdly, has been a friend of mine for over 35 years. So I'm particularly pleased to give this in his name and look forward to seeing him at the meeting.
Yeah, I gave it last year. And it's such an honor to be picked by the president to give this. Really sort of a thrill, and a wonderful tribute to Aurelio, who's been there from the beginning, one of the founding members of the Panamerican. Really, it's a great thing.
I mean, so many of the prominent Latin American and American surgeons have spoken at this meeting that one of my issues has been trying to pick a topic that would actually be educational, because this is a very experienced group of surgeons in the society, and they've now attracted so many of their mentees that this is a very well-informed group of people who come to this meeting.
And what's your subject going to be?
Don't know.
Still got some time.
Still working on it. I've had a phone call from South America that it's time to make a decision,
All right.
and I will soon.
This year, the 29th of November to the 1st of December, it will be in Mexico City. We're looking forward to seeing you there, and as many other people. Should be a great meeting. And I have to ask you one last question. What's it feel like to be covering the shock trauma?
I'm really excited at this point in my career to settle in at a place that's absolutely devoted and committed to trauma and has made so many contributions. I'm just thrilled to be here.
Well, we can't wait to have you join the group, and we'll look forward to seeing everybody in Mexico City.
Thanks, Tom.
Thank you.